A year ago, I was diagnosed with breast cancer. It was very shocking to find out that diagnosis.
Rita had breast cancer and elected to have a bilateral mastectomy, or have both breasts removed and have reconstruction of both breasts.
So I investigated flap grafts and came to find out that there are a lot of techniques that I had no idea existed.
On her abdomen, she didn't have a lot of abdominal tissue. She was a pretty thin lady and had more tissue to offer from her inner thighs. So there are two types of flaps that we can do from the inner thighs.
The one option that Dr. Snyder talked about that seemed the best for me would be to use a muscle from the inside of my thighs called the gracilis muscle, and that's the procedure that I wound up choosing.
In her case, we did what's called a TMG, which involves use of a very small piece of muscle from the inner thigh and blood supply that goes through it and the overlying skin and fat.
Dr. Snyder was very thorough in identifying risks and complications of the procedure, and fortunately, I didn't have any complications. For as long of a surgery as it was, and with as many people involved, and with the amount of work that had to be done, it was a remarkable post-op period for me.
Rita did fantastic in recovery. She had a 3.5 or 4 day hospital stay. Looks great. She wears a bikini bathing suit, and I think she says she feels very comfortable.
Dr. Snyder wanted to be sure that I was not just happy with the outcome, but very pleased with the outcome, and he would ask me that at my post-op visits. Today, I feel good about my body. And for someone who has gone through double mastectomies and reconstructive surgery, I think that's a profound statement to say. I cannot imagine what my life would be like without having this reconstructive surgery by Dr. Snyder.